Government of Newfoundland and Labrador's COVID-19 news conference. I'm Leslie Clark with the Department of Health and Community Services, and I'm the moderator for today's question and answer session. Joining us today are the Honourable Andrew Furey, Premier of Newfoundland and Labrador, who is joining us via Skype from Deer Lake, the Honourable John Haggie, Minister of Health and Community Services, who is joining us via Skype from Gander, and Dr. Janice Fitzgerald, Chief Medical Officer of Health. Please stand by. Our news conference will begin shortly.
Good afternoon. Thank you all for joining us for today, March 29th, COVID-19 update. I'll turn things over to Dr. Fitzgerald immediately for an update specifically with respect to some new information regarding AstraZeneca.
Thank you, Premier. Good afternoon, everyone, and thanks for joining us this afternoon. Just to start off with a recap, since the media advisory yesterday, we have no new confirmed cases of COVID-19 in our province. So our total number stands at 1,016, and there are 2 active cases in the province. No one is in hospital, and we've tested a total of 123,739 people. So we have been closely monitoring reports from countries that are exploring a possible link between AstraZeneca vaccine and blood clotting disorders known as vaccine-induced prothrombotic immune thrombocytopenia, which is a lot of words and a lot of syllables and we shorten it to VIPIT. What we know right now is that these occurrences are very rare, occurring anywhere from 1 in every 100,000 to 1 in a million people vaccinated. To date, there have been no reported cases of VIPIT associated with the use of this vaccine in Canada. What we are using here is Covishield, and Health Canada has made some asks of the manufacturer to provide more information for our Canadian context. Based on what is known at this time about VIPIT, compared to the risk of COVID-19 by age and considering the availability of other vaccines, at this time we are pausing the provision of AstraZeneca vaccine to adults under 55 years of age, pending further risk analysis from the UK and Europe. Adults 55 years and older may still receive the vaccine, given that the increased risk of hospitalization and death due to COVID-19 in this population, and since VIPIT reports have been even rarer in that age group. And while these reported adverse events have occurred primarily in women, investigations are ongoing, as it is possible that more women actually receive the AstraZeneca vaccine, really making it difficult to assess the risk based on sex alone. Approximately 4,000 doses of Covishield have been administered in our province, and information for those individuals regarding VIPIT will be provided today through their organizations. This will be posted on our website as well. A follow-up letter from the regional health authorities will be mailed to each recipient of this vaccine. For those first responders who are booked for a vaccine appointment this week, your appointment will go ahead as scheduled, and you will be offered the appropriate vaccine. For anyone who has already received their first dose, please remember that it is still a very effective vaccine that will protect from severe illness and hospitalization as a result of COVID-19. The risk of an adverse occurrence is very rare. Minor and temporary adverse events such as headache, fever, fatigue, or pain around the injection site are common after all vaccinations. However, anyone who has received a Covishield vaccine and begins experiencing any of the following symptoms should present to the emergency department. And these include persistent and severe headache, seizures, neurological symptoms such as limb numbness and weakness or facial drooping, blurred vision, shortness of breath, chest pain, abdominal pain, and swelling, redness, paleness, or coldness in a limb. VIPIT has been reported anywhere from 4 to 20 days after receiving the vaccine. When we have additional information from Health Canada, we will determine how to proceed with the second doses of Covishield, which are due in approximately 3 months. At this time, the occurrences do not appear to be linked to conditions that would put an individual at a higher risk of blood clots. The vaccine-induced event condition is a result of an immune reaction, and it doesn't develop through the same process as usual types of bleeding or clotting problems. Additionally, the treatment and management of the condition is a little bit different than how we would treat non-vaccine related thrombosis or blood clots. A memo has been prepared for healthcare providers to share the information they need in the unlikely event that an individual in our province should present with these symptoms. We do not anticipate any significant disruptions to our vaccination plan as a result of this change. The majority of our vaccine supply is Pfizer and Moderna. These are mRNA vaccines, which work in a different way than the AstraZeneca and COVID vaccine, which are viral vector vaccines. There have been no associations between the mRNA vaccines and this condition that have been reported. As indicated in our vaccination plan, vaccines are constantly monitored after they are approved for safety and effectiveness for as long as they are in use. Health Canada and the Public Health Agency of Canada are responsible for taking action if there are any problems with the vaccine, and they are doing just that in response to this new information. We continue to rely on their guidance as we determine the next steps for the COVID. As a recap, for those who may have just joined, we have no new confirmed cases since yesterday's media advisory, and the total number of cases in the province is 1,016. This pandemic has been rapidly evolving from day one. We have always relied on the best available evidence to guide our decision-making. Evidence will continue to change and emerge, and we are prepared to adapt in response. So hold fast, Newfoundland and Labrador. Thank you.
Well, thank you, Dr. Fitzgerald. Once again, to reiterate what Dr. Fitzgerald has said, we've said from the beginning that we would change as the evidence changes and as evidence accumulates, that we need to be adaptable and dynamic in our response to this virus and this pandemic, which we know to be causing some degree of uncertainty. But please be rest assured these events are very rare, and the evidence is being fully evaluated right now. So with that, I'll turn it over to Minister Haggie for some brief comments.
Thank you very much, Premier. Again, I would like to repeat that this is a prompt response by the province to a rare situation, and I think it's proportionate and it's in line totally with the National Advisory Committee on Immunisation and on Health Canada's guidelines. We have administered 4,120 of these doses, and the last of which were given on Friday. We will continue to monitor what comes out of the deliberations from Health Canada, and as both the Premier and Dr. Fitzgerald have referenced, this could change again. We've seen since the pandemic started in this province, we've had to be flexible, we've had to adapt, and I think this is another twist in the road that gets us to life with COVID. So with that, Premier, I'll turn it over to you for questions. Thank you.
Well, thank you, Minister. We'll now invite questions from the media. I apologize for the lateness of this delay, but we were waiting for information, and I know that the media want to bring this to you in the right way, in the correct way, and in a quick way. So that's the reason for the late media availability today. But with that, I'll pass it over to media for questions.
Thank you, Premier. For the benefit of our speakers, there are 7 reporters registered for today's call. The question and answer session will be conducted in one round, where each reporter will have the opportunity to ask one question and one follow-up. Following this, I will ask each reporter if they have one final question. Our first questions are from Peter Cowan with CBC. Please go ahead.
My quick math shows that there are still about 3,000 doses of AstraZeneca sitting in storage right now, waiting to be put into arms. How will they be used, and will they be used up by, I believe it was April 1st, or there's an expiry date that was fast approaching on the vaccine?
Go ahead, Minister.
Janice?
No,
sorry.
Go ahead.
Yeah, it's a good question. There are 2,880 doses left, Peter. 750 of these expire at the end of the week. These will be used consistent with NACI guidelines. So essentially, it's for individuals who are eligible between the ages of 55 and 69. The others do not expire for some weeks later.
And what would you say to people who may already be a bit hesitant about getting a vaccine and afraid that this is essentially too early? They want to, that the science hasn't been done on the safety and effectiveness on this. They're seeing this sort of conflicting information. We've seen AstraZeneca, it's changed from we shouldn't give it to old people, only young people. Now we're saying we shouldn't give it to young people, only old people. How would you respond to people who may now be even more hesitant? based on all this changing and conflicting information?
Yeah, so that's a good question, and I mean, certainly, I can appreciate that it may be confusing for people, but what we have to remember is that the risk of COVID far outweighs this vaccine, both in our country and around the world. So, what happened here when vaccines are tested? They use tens of thousands of people in their studies, but sometimes you can only see these very rare events when you're giving the vaccines to hundreds of thousands or millions of people, and that's what we're seeing here. So the signal has now been picked up because we've given so many doses of this vaccine. What we have to remember is that this is still very rare, and that these vaccines on the whole are safe. And, there will be more information coming in the coming days. And as we get more of that, we'll certainly be able to refine our approach with this vaccine. But we just feel for the moment that this is a proportional response to the information that we have right now. And you need to act on the information that you have right now.
Our next questions are from Kellyanne Roberts with NTV. Please go ahead.
Thank you. What happens to those who have now received AstraZeneca and no longer fit the guidelines for AstraZeneca? What happens for their second dose?
So people who are under the age of 55, is that what you mean?
Yes.
Yeah. So we are, that information is still coming in. We do have a bit of time to determine what we need to do in that situation. There are some studies ongoing that are looking at using different vaccines, and then there's, they're still studying this whole process to find out exactly, the mechanism behind this association between the vaccine and this condition. So we may, in the coming weeks, we may have some more information that will guide our advice better. So at this point, we don't have that answer, but we are certainly, we're going to be looking for that answer, and we will have it before people need to get their second dose.
Thank you. And now with this change in recommendation, the province is expecting quite a few more doses of AstraZeneca this week alone. How does this change the vaccine rollout for the province as a whole, knowing that these doses will now have to go into rotation with an older population?
So we're still looking at all the options, and but this is still a good vaccine. It's still an effective vaccine, and these are very rare events that are happening. So we will be offering it to those over 55 and over. It won't impact offering it in that group won't impact the the rollout of our vaccines too significantly. There may be some slight delays, but on the whole, I think we're still in pretty good shape to be able to offer the vaccine as we had planned.
Thank you.
Our next questions are from Sarah Smelly with the Canadian Press. Please go ahead.
Hi there. What would you say to people who are under 15, first responders, under 55, and who have received this vaccine and are now a little bit scared?
Certainly, it's a lot of news to get. It's a very, complicated condition, so I understand that people are concerned. So the first thing I would say is that what you have to remember is that out of the millions of doses of this vaccine that have been given around the world, we are still talking about very few cases. So the chance of someone having this kind of reaction is still quite low. We certainly would ask that people watch out for those side effects that I had talked about earlier. Those will be posted on our website. They will be in the letter that comes out. We do have way to diagnose this as well as a treatment that we can use. So just because this happens doesn't mean that we can't treat it. So it's really important to get, if you have any of those severe symptoms, that you get medical attention quickly. But on the whole, the risk is still very low.
Okay, thank you. And then you had said before that you would get the vaccine. Would you still get it? The AstraZeneca vaccine?
Well, I mean, yes, if I was in the right age group, contrary to what my hair would have you believe. I'm not quite there yet. But yes.
Thank you.
Our next questions are from Elizabeth Witten with All Newfoundland, Labrador. Please go ahead.
Thank you. I'm curious, when will people be reached to find out that their AstraZeneca appointment has been put on pause? And do you happen to know how many people could be impacted?
No, so appointments will go ahead as scheduled this week. And people will be offered the appropriate vaccine.
Oh, I'm sorry, can you clarify when you may say appropriate vaccine?
Yeah,
like
so
the one they follow up on?
Yeah, so depending on their age, they'll be offered the vaccine for that group. Yeah. Thank
you. And I'm curious, what role did the vaccination committee play a role in this decision?
Sorry, Sarah, do you mean our vaccination committee provincially?
Yes, the provincial one.
We actually acted rapidly on the basis of the information that we had yesterday and this morning, really. So the vaccine committee weren't directly involved in this. Their main role has been around how to roll out the vaccine, but certainly we will be updating them. No, this was a public Health Canada decision, and we wanted to move on it as rapidly as possible.
Thank you.
Our next questions are from Peter Jackson with The Telegram. Please go ahead.
It was only about a week ago that Health Canada was saying that they're aware of the situation with possible blood clots, but that they don't see it as being a problem. What changed in that short period of time?
So there was a lot of research that actually went on in the last 10 days or so, and certainly we've initially there were very few cases that were reported. Now, there's some reports in the UK data that perhaps there are cases there as well. So I think it's just that people are recognizing that this is a real signal in the data. And then we've seen some research in Germany with that have been able to sort of deduce a mechanism behind the whole process. So how this happens, and certainly there was a tight correlation with vaccination in the previous 4 to 20 days. So all of that evidence sort of led to this decision over the weekend, and that's what this pharmacovigilance is all about, and vaccine vigilance is all about. It's looking for these signals that can happen, and trying to decide if they are indeed related to vaccination, or if there's another plausible explanation. The research is still ongoing, but given what we're seeing, we felt this was an appropriate response.
Thank you. And can you explain a little more about this thrombosis combined with low platelet count? Is this a particularly rare event overall, or is this just part of the way that blood clots often happen?
No, I'm not a hematologist. I will preface anything that I say by saying that I'm not a hematologist, so not at all an expert in this field. But learned a lot over this past weekend. And so basically what it seems is that it's an immune mediated, so there are antibodies that get produced related to some factors that are associated with platelets that cause the platelets to clump together. So your platelets are your blood clotting cells in your body. It causes these platelets to clump together and to form clots. And so when you do that, you use up all the platelets. So then there's not enough platelets circulating to help prevent bleeding. And so the balance that's normally there in the body of the clotting and blood thinning mechanisms, we'll say, that balance is thrown off. So you see clots that form, use up all the platelets, and then you have a low platelet count, which predisposes people to some bleeding disorders. So it can be, it's really just the balance, throws off the balance of that blood clotting and thinning mechanism in the body, which is always sort of working they work together to make sure that our blood stays the way it should, right? But it's just been thrown out of whack by these antibodies, essentially. The issue is that we haven't figured out sort of what happens between the vaccine and the antibodies. And that part is still being researched.
Okay, thank you.
Our next questions are from Allison King with VOCM. Please go ahead.
Hi there. I'm just wondering, for those who might have health concerns, perhaps people who have had blood clots in the past but may still fit into the age group who are eligible to get the vaccine, what is your advice to those people?
So the information that we have right now says that there does not appear to be an increased risk in people who have a history of blood clotting disorders due to, some people have different blood clotting factors in there that don't work properly, and so they're more prone to blood clots in general. So there doesn't appear to be a connection in this way because it's a different mechanism of causing a blood clot. So it's an immune mediated mechanism that causes this blood clot. So in that respect, it doesn't appear to put those people at increased risk from receiving the vaccine, and it's not something that we've seen. However, we have to remember that these are very small numbers. I think for any people who have those concerns, the best option would be to discuss with your healthcare provider, your family physician, or if you're under care of a specialist, your specialist to decide if that vaccine is the right one for you.
Thank you. And I'm just wondering if we know when we will be receiving more doses of the Pfizer and Moderna vaccine.
Minister, can I defer to you there?
That's probably for you, Minister.
Yeah, no, certainly. Yes, we get the Pfizer on a weekly basis. It usually comes in either on a Wednesday or a Thursday. Some of that's weather dependent, some of that's supply chain. Moderna comes in, and we're expecting a tranche this week. My recollection, and I may be off by a tray or two, is we'll get 12 trays, or just around 13,500 doses. We are due for some weeks with 13 trays. Moderna is a little less clear sometimes. They deliver every second week, and they usually only give us a short notice before it arrives. And I couldn't honestly tell you when the next Moderna trays are scheduled, but I can certainly find out for you.
Thank you.
Our next questions are from Roger Bill with the Shoreline News. Please go ahead.
Thank you. Premier Furey, Dr. Haggie, congratulations on your election win. I want to ask a follow-up to something that came up in last Wednesday's briefing. Telegram reported the story about 2,800 people who seem to have booked prematurely appointments outside the normal registration process, going through a side door or a back door in the software. So my first question is what happened? Stephen Clark of the Center for Health Information is quoted as saying, layering the system with the priority group preferences based on age, range, occupation, etc., has created some complexities and challenges beyond the capabilities of the technical solution. Dr. Haggie, in plain English, can you explain what that means?
The software couldn't cope with the various criteria, is what I have been told. That is something that NLCHI are endeavoring to work with and to deal with. My information from Eastern Health, where the effects were more noticeable, and from NLCHI, is that we have essentially two different priority groups, one of whom kind of got in by sharing informally of website links and passcodes. I think there was no nefarious intent. I think that was the word that Mr. Diamond used. What we have done, however, to narrow that down is we have a system in place now, or at least NLCHI have a system in place now, where the websites and the passcodes are changed on a 48-hour basis to make sure that the people who should have them do have them and that they do work. So I think it's a shortcoming of the software. Whether or not there is a software patch, I would leave to the coders, and that might be a better question addressed to Mr. Clark and his team.
Yeah, Mr. Diamond said he didn't think there was anything underhanded or anybody's trying to cheat the system. I'm not sure, based on anecdotal evidence, that people agree with that. One of the questions I've most frequently been asked in the last several days is about this. Last week, Mark Quinn of CBC asked you whether it was you responded to a question from Mark Quinn. You said that if you were one of those 2,800 people who were 70 plus, you should go ahead and get the vaccination. But there was a report last week. There were 4,080 plus individuals in Eastern Health who are still requiring a vaccination. So how is letting 2,800 people jump the queue fair? That's the question I'm hearing.
I think the issue is how are the 4,000 who haven't got their vaccine to be addressed. I think they are also in priority groups from the information that I have. You've got to remember, one of the challenges we have with our priority groups is we actually have 25% of our population who fit into a priority group just on age alone. So when people look and say, well, you know, you're behind with doing the general population, our general population as a proportion of our population is a lot smaller than in other jurisdictions. We have the highest age burden, not meant in a bad way, but it is what it is, which we've had to vaccinate. So those people also are in the high priority groups. The others were in the high priority groups. It's very difficult to say whether an 83-year-old should go ahead of an 82-year-old or an 84-year-old. We've done them in 5-year batches. If we had vaccine supply in greater number, we would do them in 10-year batches or even 15. So I think Eastern Health are aware of those 4,000 individuals. I think there were some challenges with contacting some of those, and that has been worked on, and my understanding is they have a solution, and they're working through it.
Thank you.
I will now go back through each reporter to see if you have one final question. Peter Cowan with CBC, do you have a final question?
I do, and this is about when are people told which of the brands of vaccine they're going to receive, and what happens if someone, for example, who's 56 and is told you're going to be getting AstraZeneca, doesn't feel comfortable? Is there a mechanism for them to say, look, I want to go back on the waiting list, I'll wait until there's a Pfizer or Moderna dose available for me?
Yes, people always have the option to, to have a choice with regard to this. If somebody is offered a vaccine that is appropriate for their age group and they decide not to take it, then they will be able to go back into the queue, and then it will likely be as a result of age that they will get recalled into the queue for a vaccination. And then depending, there may not be a guarantee that, there will be an mRNA vaccine at that time. It could be a different vaccine if we have more vaccines that are available, or it may be the AstraZeneca again. I guess, we've always still said that you should take the vaccine that's been offered to you, but people still have a choice, yes.
Thanks.
Kellyanne Roberts with NTV, do you have a final question?
Yes. In terms of where we stand with the vaccine rollout now, can we get an update on how close are we to being done with those 70 years and older, and when we could be expanding pre-registration?
The vaccine rollout, given the changes in eligibility that we've talked about now, The vaccine rollout will be delayed. It will be slow. Our current estimate, and we're working on some of the numbers, is that it could be between 3 and 4 weeks before we complete phase 2, longer than we had anticipated. But we're in the process of trying to quantify that a little more accurately. As you can understand, this decision is a couple of hours old at the most, and staff are still working on that.
Absolutely. Thank you.
Sarah Smelly with the Canadian Press. Do you have a final question?
Yes. Prince Edward Island seems to be suspending their AstraZeneca program for everybody. They're not going to shift and offer it to people over 55 until they get a little bit more information. Why aren't we following that course?
So PEI went out today, and we have to remember PEI was offering, they were only offering this vaccine to people to younger people, first of all. So they went out earlier today, and they said that they would be pausing until they got more information. So they didn't say they wouldn't be offering it to over 55. They just said that they would be pausing right now until they got more information. At least that's what I've read out of the media reports. So I think that, we all had discussions, and I think we all support this this direction. So I think, we have to do what we feel is best and what's the most appropriate. We can't really compare ourselves to other places, but I don't know that we've heard the last from PEI at this point, just based on what I read.
Okay, thank you.
Elizabeth Whitten with All Newfoundland Labrador. Do you have a final question?
Yes, I do. If AstraZeneca is off the table, at least for now and the foreseeable future, will Newfoundland and Labrador receive other vaccines to make up for it?
No. So
that hasn't been discussion.
Yeah.
We're all about to answer there. That hasn't been discussions that have been ongoing just yet. Of course, we're dependent on the federal supply chain in terms of different vaccines, whether it's the new Johnson & Johnson or Moderna, or the Pfizer vaccine that's approved right now by Health Canada. So we're waiting to hear more information from the federal government, of course, always.
Thank you.
Peter Jackson with the Telegram. Do you have a final question?
Yes, I do. Sorry. The committee that looks and assesses things for the European Medicines Agency, they're meeting with experts this week on thrombosis and interfaces and all that to see if they can get a mechanism of action. I assume things like that are going on at the Canadian level as well. What timeline do you expect to really get a good answer on whether this is a serious concern or not?
So I know that there were meetings that happened over the weekend, and perhaps some that are happening today. So I expect over the next few days we'll have a little bit more information. But this is so new, and it is something that we are, we're just getting initial information on with regard to a mechanism or anything like that. That could take a while before we have those answers. I mean, I think it's amazing the amount of information that we actually do have at this point, 10 days later, So but we expect a little bit more information about epidemiology and that sort of thing in the next few days.
Thank you.
Allison King with VOCM. Do you have a final question?
Yes. So for those who received their first dose of the AstraZeneca vaccine, and say it turns out that they just can't receive their second shot, how protected will they be? And in that case, could they potentially switch to get an mRNA vaccine?
So that information is still being looked at, and we expect, we do have a bit of time. There's a little over 3 months before people have to get their second vaccine. So we will be looking at this information. There are some studies being done at the moment that are looking at getting an mRNA vaccine after getting a viral vector vaccine. And so, we'll have some more information in the coming in the coming weeks to months, and we'll make our advice and recommendations at that time. But right now, we don't have that information.
Okay, thank you.
Roger Bill with the Shoreline News. Do you have a final question?
Yes, I do. Dr. Haggie, according to numbers on the most recent numbers on the government website, we're not on track to hit the target of 80,000 people vaccinated by the end of the month. Do I understand when you were saying that your officials are reviewing the numbers now for phase 2, that it appears that it's going to take 3 to 4 weeks longer to complete that? Does that mean we aren't going to hit the 80,000 mark? Is that what you're saying?
I think there is going to be an adjustment. I mean, of the AstraZeneca vaccine, that was included in that total, my understanding. So obviously that will need to be revised. The website, there's some reconciliation that takes place between vaccine that's arrived and vaccine that's delivered. Some of our rural clinics still work on a paper-based system, which then has to be inputted into the electronics. So those numbers often lag a little and have daily fluctuations. But the impact of not being able to use the AstraZeneca in the way that we had planned is still under analysis. But it's effectively taking vaccine out of our hands in some respect for those groups that we have to then backfill with the mRNA vaccine. So that impact has not been fully analyzed yet. As I say, this decision is only a couple of hours old, and we'll have more information about that once that analysis is complete.
Well, I'm sorry. I thought Dr. Fitzgerald said the AstraZeneca thing wasn't going to significantly affect the overall hitting, the numbers.
Well, at some point we.
Yeah.
Sorry.
Go ahead, Minister Haggie.
Yeah, at some point you have to recognize that we've taken out of the equation, some people who would be eligible for AstraZeneca who are now no longer, and therefore we will have to provide them with the mRNA. What will happen is at some point that movement of vaccine will catch up with it. So unless we get the extras that we're hoping for but haven't been promised, then it will have a delaying effect on our timelines for the completion of phase 2. The worst case scenario at the moment is 3 to 4 weeks. If we get the extra Pfizer and Moderna particularly that has been suggested but not factored into planning, then that will shorten that delay. But again, it depends on whether you regard 3 weeks as material or not.
Thank you very much.
Thank you, everyone. Premier, do you have any final comments for today?
Yes, thank you all for joining us, and especially thank you to the media. I know some of you up against deadlines, so thanks for understanding that we kept this to 3 questions. We wanted to make sure you could meet your deadlines. In any case, the take-home message is this is a rare event, but it's an important event that we wanted to educate the public on. If you have any of the symptoms, if you received the AstraZeneca vaccine within the last 4 to 20 days, and you have any of the symptoms that Dr. Fitzgerald talked about, such as severe headaches, neurological symptoms, or you can review them on the website, then you can either go to 811, or you can talk to your medical provider, or go to the emergency department if it's appropriate. We will be working out the details of the vaccine and the vaccine rollout and what implications this has over the next several days, and we look forward to providing you with some more updated information on that. So thanks for joining us. If there's any questions, please reach out to 811 if you have received that vaccine, and they do have potential answers for you on how to answer your questions. So thank you for joining.
Thank you, Premier. Stay safe, everyone. Take care of yourselves and each other, and enjoy the rest of your day.
This is Jan. Jan sometimes visits her neighbor Paul. Paul has COVID-19, but doesn't know it. Jan also takes the bus. So does Mo, who's a frontline worker. So if Paul infected Jan, Jan could infect Mo, who could infect a lot of people. But wait, they all have the COVID Alert app. So Paul tested positive and entered a code in his app, which anonymously alerted Jan. So Jan stayed home and Mo went to work safely. Phew, close call. Help break the chain of infection. A message from the Government of Canada.